Hello, Dr. Rotchford here again in topics in opiate addiction. So in my last discussion, shame came up, and it commonly does when we're dealing with addictions to substances, and we got to address it formally. So in the first one or two topics, I brought up the notion of the blame game, that it's not very helpful, that let's stop it, get into the solutions, let's look at what we can do differently. But if we start blaming ourselves or others, it just doesn't go very far. Well, I call this the shame game now. Okay, it's not the blame game, it's the shame game. Does it work? No. Sorry. No. Shame yourself as much as you like. I don't think it really works very well. If it did, hey, I'd join in. Let's just have some fun at this. But no, it makes things worse usually, not better. So let's stop it. How do we stop it? Ooh, that's a good question. So, first of all, acknowledging it, talking about it, it's like any other feeling. If we are least accepting of it, it's more likely just to go away. And really, it is kind of a feeling that we're talking about. It's a yucky feeling. And yeah, it's powerful. We can manipulate ourselves and others temporarily through it. But it's kind of like fear and envy and all kinds of those weird feelings that can motivate us in kind of weird, strange, inappropriate ways oftentimes. But okay, it is what it is. And it's a human feeling. And okay, how best to address it? Well, I already said, let's talk about it. Accept it for what it is. And then see if we can let go of it. If there's a reason for it, okay, let's maybe take some steps to acknowledge same. But I don't think there's any reason for shame. Well, I'm sure there's an exception to every rule, but off the top I can't think of it. So I want to help you and me and everyone get rid of it. Okay? When we're wrong, did something wrong, promptly admit it, as the steps say. Hey, get on with it. To make proper amends to whenever you can. Doesn't harm yourself or others. Hey, we got to do that because we all make mistakes. But let's get out of this shame that we're defective, we're problematic just because we're not perfect and we don't always behave in reasonable or socially appropriate ways. All right, we're human beings. All right, that's one way, just acknowledgement of our being human and being okay with it. What choice do we have? So this is another strategy. Maybe it'll help. In medicine, oftentimes we label things as disease. I mean, people have horrible things on their face. It would be very shaming. I don't know. In the past, maybe were the infectious disease, not being able to walk. But if we give labels and we qualify it as a disease, hey, we're just like everyone else. We have a disease. And so I think using the disease model is very appropriate when it comes to substance use disorders and addictions in general. So people say it's not a disease, it's a behavior. You got to say no. Kind of buckle up, get your stuff together. Don't tell me this is a disease. This is just people being lazy and wanting to feel good and not having any discipline or self-will. This is a lack of willpower. This is what it is. Wait a sec. If it's a lack of willpower, then people had a lot of willpower, they wouldn't have a problem with this. But it seems like just the contrary. The more willpower they have, the more likely they are to be challenged in recovery. In fact, the first step wants to address that straight off. Hey, we're powerless over this. Our lives have become unmanageable. We're out of control. And that's okay. We got to turn it over. We're not in control. Turn over to a higher power even. I mean, this isn't just your best friend or something. I mean, we got to bring in the big guns. I mean, listen, if you think you're in control of all this stuff, well, hey, wait a second. All right, so maybe it's not a question of willpower. In fact, I'm not even sure about willpower in general, the whole concept. But that's another discussion. All right, now, I'm getting back to this notion of shame and letting go of it. It's maybe not a question of will. Maybe it's actually a disease. Listen, we know the genetics. We know the pathophysiology. We know prognosis. We know effective treatments. Gee, it sure sounds like a disease. It even has a nice ICD code. Or, new ICD-10 code. I mean, it's the real thing. I mean, it has subcategories in on agonist therapy and remission and acute and chronic. And hey, it sounds to me like a disease. In fact, take a look at the brain under the effects of this disease and you'll say, this is not right, not working right. So let's call it a disease. Now you can say, well, it's not a disease. All right, you can call it whatever you want. Does it help you? We have good data that if you call it a disease and address it as a disease, the prognosis is better. People have better outcomes. So I'm a practical guy. Fine, let's call it whatever you want. I mean, you want to call it bubblegum. Fine, call it bubblegum. Does it work? Does it help you? Things get better? The evidence says if we call it a disease and treat it as a disease, we get better outcomes. So I conclude it's a disease. Or let's at least assume it's a disease until someone knows something more about it than I do, but sure sounds, looks, behaves like a disease. So why don't we consider it a disease? That's another maybe discussion for another time. But anyway, hey, here's to say it's a disease. Let's get into the solutions. Let's acknowledge the shame around these issues when our behavior isn't always, quote, what others would consider rational or understandable. Let us know that on some levels it is very understandable. And the idea is knowing and understanding the behavior sometimes opens the doors into new ways of responding and behaving. And really, part of the good news with opiate addiction is that if you address it, your life can get really good. I mean, better than the average person's. It doesn't mean that you have to die younger or be miserable the rest of your life. No, to the contrary. If you really address it appropriately, your life can be great. Better than maybe it would have been otherwise. Who knows? That's good news. And I'm glad to share it with you. Thanks for your attention again. Till next time.